Buenos días, senhoras e senhores. Primeiramente, me gostaria muito agradecer-lhes a los membros da organização por la oportunidade de estar aqui com vocês em Bogotá, para que compartamos experiências com respeito ao papel da história clínica eletrônica em la transformação digital em saúde. Eu sou cardiólogo e no ano de 1998 comecei a praticar mis atividades clínicas médicas em um ambiente completamente sem papel. Graças a ello, no ano de 2001, fui invitado a participar em el desarrollo de um sistema informático de história clínica. Esse sistema está assim, que desde o ano 2010 ha pertenecido a Philips e hoje está implementado em mais de 1.600 hospitais da América Latina, com o objetivo de melhorar a vida de miles de profissionais da saúde e pacientes. Esse número inclui instituições em Colômbia, Argentina, México, Bolívia, República Dominicana e Brasil. Esta atividade, em consequência, cambiou completamente minha carreira médica. Exerci as atividades clínicas e de informática em saúde simultaneamente por mais de 2 décadas, hasta a pandemia de COVID. Desde então, me dedico integralmente à transformação digital em saúde. Infelizmente, eu não tenho a fluência adequada para fazer esta apresentação diretamente em espanhol. Quisiera, com sua anuência, cambiar o idioma para o inglês. So again, good morning, ladies and gentlemen. It's a pleasure to be here. So when we started that, more than 20 years ago, we thought about how could we transform healthcare at that time using technology. So today I will present to you the summary of this journey and what we think about that. So I have a brief presentation, 20 minutes, short introduction. I will explain some concepts, technology solutions and use cases, the futures of the electronic medical records, and take-home messages. So everything started here in Blumenau, a German state, city, southern Brazil. Today we have there the Philips headquarters of TASIMR, with more than 1,300 people working every day to support our customers in this digital transformation in healthcare. I always like to mention this quote of the Dutch philosopher Spinoza, that everything that happens occurs through the operation of the necessity. So I still do remember 20 years ago, 25 years ago, when I was in the emergency department, 4 a.m. in the morning, and a patient with chest pain came, and he told me that 4 days before, he underwent to a cardiac cath angiography, but he forgot to bring this to the consultation. So, because they went to the house in a hurry. So, and then imagine, so I was dealing with a patient with a chest pain that underwent angiography 4 days ago, and I didn't have this result to determine my approach to this patient. Then I realized that information is more critical than even the education of the healthcare professionals. And I started to think, how could you bring this information from the cath lab to the emergency department all the time? Then we started to do that. But there were also other problems we had at the time. I have a collection of more than 30 cartoons, comics that I draw at that time. The first one, for sure, is the handwritten notes that nobody was able to understand. So this was the first, that time, 25 years, we created those cartoons to communicate what was our value proposition. Another one, we were investing a lot in engines to handle paper, manage paper, though let's use technology in a different way. This one, the nurse was all the time the hub of the care treatment, so everything passed through her, and the patient sometimes was forgotten because she didn't have, or he didn't have time to take care of him. And another one, this communication, advanced communication method, these sharp pointed devices, the way we communicate between the departments in the hospital. So using technology, we could solve several different issues to improve the operations and also the clinical results. And if we want to use electronic medical records, Historia, Clínica, Electrónica, to change healthcare, what are the problems we are going to change? So I have here some examples. So the preventable medical error, everybody do remember the publication of the Institute of Medicine in 1999 that mentioned that medical errors was one of the most important causes of death in the United States. And this was the impulse to make the transformation later. So the poor amenable mortality rates, lack of transparency, difficulty to find a doctor, high cost of cares, lack of insurgency coverage, nursing and physician shortage, and inefficiencies. But we have plenty more. And for sure, technology, and in particular electronic medical records, can play a pivotal role on that. Till recently, this publication is from 2016. It still confirms that medical error is the third leading cause of death after heart diseases and cancer, even now. And we knew for a long time, if we implement electronic medical records from collector to documenter to helper to colleague and to mentor, we can really improve and reduce this mortality due to medical error in healthcare in general. Why electronic medical records is able to change healthcare? First, because the documentation. So we are able to collect structured data and aggregate the data and share the data through the different stakeholders in order to improve clinical decision and operational efficiency. Processes integration, as I mentioned before, so we can use best-of-breed solutions and best-of-suite solutions, enterprise solutions that are able to communicate the information through the entire chain, and also in different levels of care, primary, secondary, and tertiary. Care continue. Due to this information, we can act in the patient journey, in chronic disease management, preventive management, and population health, as it was mentioned before. So what are the technology tools that can leverage that to guarantee mobility, bedside support, portals, cloud, big data analytics, Internet of Things, voice recognition, as was showed before, in cyber physical systems. So, via interoperability in connectivity, we can integrate with monitors, equipment, devices, PACS, knowledge sources, softwares, government, etc. And we can improve the clinical outcomes and facilitate the operational excellence, avoiding waste, fraud, and changing from fee-for-service to for performance to value-based care. And in the end, change the panorama regarding patient safety. I will talk a little bit about big data and analytics because this is the most popular in the moment. So you know that 30% of data produced worldwide is produced in the healthcare and life science industry. And 70% of the data that are in the hospitals, they are not utilized. Only 3% of the data is utilized. So you mean the power we have if we use this data to improve the clinical excellence and the operational excellence. Everybody knows the 4 V's of the big data, but according to AI, now we are changing the paradigm because of the machine's eyes. The machine's eyes, they are able to see and to detect more than sometimes the human eyes. You saw this article from Google, I think it was in 2019, when we did fundoscopy to detect retinopathy, and the system by itself recognizing patients under heart attack risk. A recent, for example, publication in the Nature that, for example, using X-ray, the machine eyes was able to detect diabetes type 2 in a opportunistic situation. Imagine the patient goes to an image department and then to perform an X-ray and receives this potential diagnosis. In ChatGPT, the generative AI is now really changing the things because the ability due to the large language models to read the information in different aspects is able to bring different insights. I recommend this article from Professor Topol, published in Nature, regarding this new concept of generalist medical artificial intelligence. And you see here in the picture that, for example, a multimodal self-supervised training, so we can use text, audio, messages, images, EHR information, signals, genomics, and graphs match with the medical domain knowledge and with flexible interactions, bringing insights in the practice. For example, to guide the healthcare professionals to anticipate, to do things in advance before the patient deterioration, for example. Very interesting article. Regarding EMR and AI, so AI can facilitate the workflow, improvement of data entry and documentation, coding and administrative processes. So this is the digital assistant concept. Document generation through natural language. Generative AI can convert data, structured or unstructured, into reports, intelligent summaries, and timelines, patient journey. Predictive and clinical decision support modules, and data sharing. Machine learning can be utilized to share insights and learning between healthcare organizations without sharing sensitive patient information. For sure, EMRs empowered by AI will bring different results in a short term. Although we faced 2 big winters using AI in the decade of 70 and 90, I believe that currently with the generative AI, we won't face a 3rd winter anymore. About the future of EMRs and some take-home messages respecting the time. So here you see EMR being anywhere in different devices, supporting clinical decision, bringing insights with flexible interactions. And this is an important view that I want to bring to you. What is our future of we that work with digital healthcare? So we have the health data from the patient and from a population. So we have vital signs, lab exams, image, pathology, devices, wearables, literature, data that come from literature. From patients that are in hospital, in low resources areas, remote, rural, or in-home. This data is gonna go to a central place of integration with decentralization using cloud and blockchain, neural networks, machine learning, AI, big data, analytics, and deep learning to really create engagement and intervention, communication with the patient, appointments, citas, diagnosis and therapy, follow-up, active management, lifestyle and adherence, early warning and triage, remote optimization and guidelines, and early referral for advanced therapies. So we are coming from a system of records, going to a system of insights, and being a system of engagement. Connectivity, interoperability, mobility, IoT, cloud, voice, cybersecurity, privacy, and usability are crucial to allow this future to happen. So today, we still see that we have plenty types and amount of technology, but we are still not transforming healthcare in a large scale. So let's do this in a smart way, try to really reduce costs and bring this to more people as we can. So EMRs, they are and will be core in care management and delivery. They have a cardinal role in healthcare transformation. They have a continuous evolution in the purpose, way, and scope of use. They are empowered by technologies, coming from system of records to system of insights and then system of engagement. Even though we have this big amount of technology and resources, configuration, personalization, and training are mandatory to have a successful implementation. So, thank you very much. It's a big pleasure being with you. Let's talk later because we have a second session. And wish you a very pleasant day. Thank you very much.